Depression. It's a word we hear all the time, but what does it actually mean? For millions of people worldwide, nearly 1 in 10 adults in the United States, depression isn't just a bad day or a rough week. It's a serious medical condition, and it's the leading cause of disability around the globe. Let's clear up a big misconception right away. Feeling sad or down after a setback, like a failed test or a tough breakup, is a normal part of life. Those feelings usually fade as life moves on. Clinical depression, though, is different. It's a mental illness that doesn't just pass with time. It sticks around for at least 2 weeks, often much longer, and makes it hard to work, enjoy hobbies, or even connect with loved ones. So what does depression actually feel like? The symptoms can be different for everyone, but most people experience a low mood, a loss of interest in things they once enjoyed, changes in appetite, and trouble sleeping, sometimes too much, sometimes not enough. There can be feelings of worthlessness, guilt, low energy, trouble concentrating, and even thoughts of suicide. For doctors to make a diagnosis, at least 5 of these symptoms need to show up and stick around. You might be surprised to learn depression shows up physically in the brain. Imaging studies reveal smaller frontal lobes and hippocampal volumes in people with depression. There are also changes in how the brain's chemical messengers like serotonin and dopamine work, as well as disrupted sleep cycles and even hormone imbalances. But despite all this, science still can't predict exactly who will develop depression or why. It's a complex tangle of genetics, biology, and life experiences. One of the toughest parts about depression is how invisible it can be. It's not like a broken arm you can't always see when someone's struggling. On average, it takes more than 10 years for someone with a mental illness to seek help. Stigma, misunderstanding, and isolation all play a part. But here's the hopeful part. Depression is treatable. Medications can help balance brain chemicals. Therapy provides tools for managing thoughts and emotions, and sometimes both approaches together work best. For severe cases, doctors might recommend electroconvulsive therapy or explore new treatments like transcranial magnetic stimulation. If you know someone who's struggling, don't try to cheer them up or compare their pain to everyday sadness. Instead, offer practical help like helping find a therapist or just listening without judgment. Remind them that depression is a medical issue, not a personal weakness. Open conversations can save lives, and simply asking about suicidal thoughts does not increase risk, it can actually lower it. Depression is common, serious, and treatable. The more we understand it, the more we can help ourselves and each other. So, let's talk about depression openly, support those who need it, and keep pushing for better treatments and brighter days ahead.